Good morning, I'm Brad Spiegel. I'm an interventional pain management specialist, and today I thought we'd talk about something very common, pretty much all of us know about, and that's headaches. Headaches can be broken down into two different categories. First would be secondary. Secondary headaches are headaches that are due to another process. Very, very important to actually look at these first because the process could be something life-threatening or surgical, such as a tumor, malignant high blood pressure, or stroke, or glaucoma. So it's very important to look at those first. Primary headaches are the other type of headaches. They're usually broken down into three different categories. Tension headaches, migraine headaches, and cluster headaches. Not every headache fits into these categories, but most do. We'll start off with the tension headaches. Tension headaches, most people probably know what they are. They're usually associated with loud noises, bright lights, a lot of stresses in life. If you have bad sleep patterns, a lot of stress at work, these all could precipitate a tension headache. Tension headaches are usually located bilateral, or both sides of the head. They'll usually start in the back of the neck and go forward. They can be moderate to severe. They could last anywhere up to a day, even possibly up to a week. Mostly, everybody's seen them. You take a person who's had a long, stressful day at work, long drive home, they come home, the kids' stereos are blaring, and you see them and they're sitting like this, and it's a stress or a tension headache. It's a diagnosis by exclusion though, because you have to eliminate everything else before you can label it as a tension headache. Most of these headaches are, as I mentioned, resolve spontaneously, or you'll take some anti-inflammatories or Tylenol and they usually resolve. Migraine headaches also are quite prominent in the population, more in women than in men. Unlike tension headaches, they're located usually unilateral or one-sided. They could start from the back and work their ways forward. They could be pulsatile. They're usually associated with nausea and vomiting. Very common to have auras. And auras are events that people feel before the headaches. They can be sparkling of lights, weakness, changes in vision, but these usually will come before the headache. The next headache is cluster headaches. Cluster headaches are located more around the orbit, around the eye. That's where they begin. They're sharp. They're like a knife. They don't last as long as a migraine headache. They have similar etiology or reason why they happen, but they are more located around the eye. They're probably one of the more shorter lasting headaches. They last between anywhere from 15 minutes to a couple hours. As far as what to do for the headaches, tension headaches are separate, but migraines and clusters have a reason related to vascular dilation, also neurotransmitters, so we try and focus on that. There's two different ways to treat the headaches. First, you have to treat the headache that's already occurring, and we can do that with opiates or narcotics, anti-inflammatories, ergots or Imitrex, anything to stop the headaches and try and decrease the length of the course, or the length of the headache. The second thing is to go after the frequency of the headaches, or trying to keep the headaches from happening. And for that, because it's vascular related, we can give medications such as beta blockers, antidepressants, antihistamines, and so on. But most importantly, what we address in our practice is the multidisciplinary approach. We have to address also what's causing the headaches as far as stress at home, increasing activity, exercise, nutrition, biofeedback. All of these modalities will help keep the headaches from coming back or shorten the course of the headaches. So with these different approaches, we can make the patients more functional, they exist more in life, they try not to have the headaches be as debilitating, and they can enjoy life. I hope this has helped you a little bit, and thank you very much. Have a nice day.